your gum as it's pulling it up, so it kind of protects the gum around there.
Okay.
Do you want to have a go? Yeah? Alright, so that's, yeah. Yeah, so that's for that. But the first thing you always do is lift the papillae, which are these kind of pointed bits, okay?
Yeah.
So you turn the instrument round, you hold the instrument like this, like a pen. Okay, so hold the instrument like that. That's it, okay. The pointy bit underneath the points there, yeah, and you're using that to lift. And then do the other one there as well. And then you turn the instrument round like that, and then you're lifting up. Yeah?
Yeah.
So that's fine. And then the other one is fairly straightforward. So that is where you've done, you've got the incision back here.
Is it that way? Yeah.
Yes. So you're going underneath and peeling back. Cool?
Yeah.
Okay, so that's that one. So yeah, so make sure you show this so you can separate the things, alright? Do you want to try that one as well?
This one, yeah?
Yeah. And then I'll go through the other instruments in a
So
second
it's
as
the
well.
cut there.
Yeah, so you just you can just show them that you're doing the cut. Yeah, so making the 3 cuts. Yeah, that's fine.
And then which one is it next?
This instrument, the Zingheim. Yeah, that's it. You can use either side really, and you're using that to push the gum away on each side.
Yeah.
Yeah, okay. Alright, and then at the front, you're using this, which is the micro boozer.
And then
So you use the pointy end. Yeah, that's it. To lift up each papilla. Yeah, so what you do is, remember with these, there's always a sharp bit and a curve.
yeah.
So the curve always needs to go outside. So you're placing that underneath and just gently lifting the edges.
To protect the gum.
Gently lifting the edges. Right. Hello.
The smile line is on the line. One of your pages.
Side and then go underneath and then. Yeah?
Yeah, that's
So it would start with this, right?
Yeah.
That's where we start with.
So what you do, basically,
So-
this is the way that you're going to talk to these people through this, right? You're going to say the way that our clinical dentist designed this kit was to make sure that it simplified the process of doing the surgery as much as possible. So we have a flow going left to right and then over to the top. Okay, so your examination, then your incisions, then your lifting, then your cleaning, then your stitching everything closed. So that's the way that the kit was designed. Okay, so then you just go through them about these. I don't know why these are so mucky. They need to clean these up. So you've got 2 instruments here. You've got, this is called an Explorer probe. This is for just checking around sites pretty much. So say for example, if there was a void here. So you see there's no void around on this one. Can you see that is all intact, that bit of bone there?
Yeah.
Whereas on here, there's like
Oh,
a
I
big
see,
space, right? So we're going around here saying, yeah, that feels all right with the probe. But on this one, oh, wait a second, what's going on there? You know, it's a big hole, right? So this is your Explorer probe to check around, okay? The second one here is called a UNC15. So this is graduated in millimeters. Okay?
Yeah.
And the reason why it's graduated in millimeters is because then you can measure it. So say for example, if I want to place 2 implants in this site, okay, then I can measure from here to here how much space I've got, where I need to place my implants, and I can mark in where I want to put them there as well.
All right.
Okay, so it's in millimeters.
What's that called?
That's called a UNC15 probe. You need to just give her the list of
Yeah,
the stuff there as
sure.
well. So then you've got the things for making the cuts, which is the straight with the SM69 and another with the 15C blade. So you've got 2 of those. Then you've got all the lifting instruments which you've gone through there before, which is the Molt, the Zingheim, the Boozer, and the respiratory. So what you do is they're going to know what a probe is. Everyone knows what a probe is, right? But then this one, then you say, look, so then we've got this one, and we basically go through, and it's got millimeter graduation, so you can mark out exactly where you're going to be placing your implants or measure the depth of sight. Okay, so that's that one. Then this is when you do, you show your cuts. So you say, if you're doing a crestal incision, this is what this is called, okay, then you can use something like this, which is a single-sided blade. But we also have in the kit a triple-sided blade for more smoother motions with what we call palatal sparing flaps. So you're basically going more into the palate, and you can just show them that it goes all the way around like that. Okay, so you've demonstrated those two instruments. Then you do your lifts with all of these to demonstrate those, and then after that you've got 3 instruments here, which are cleaning instruments. Okay, so they're all basically like spoons. Can you see? Yeah,
Yeah.
they all look like spoons, right? This has got this is called a margin trimmer. So if there's like bits of bone, like you can scoop them out and stuff like that.
Right.
Okay, but they're all for, if you imagine, if you take out a really grotty infected tooth, it's going to have all this kind of infected stuff around it, and you need to clean the site. So all these are the different types of spoons for different angles. So if you're going towards the front, you need something like this. So all you're doing is going in and cleaning. Okay. If you're going towards the back, you have a curve in it, because if you imagine, you can't. If you imagine you're trying to get in here, in somebody's mouth, how is that instrument going to fit unless somebody can open their mouth like that wide?
Yeah.
It's impossible, right? So you have to use the one with the curve, because then you see that comes out in that angle, right? So using that, cleaning the side, this is the same thing. This is also for cleaning. Okay, so these 3 are cleaning instruments. And then you've got your stitching instruments. So you've got 2 cryowoods and the scissors. And all you need to do is tell them that we've got 2 cryowoods and the scissors. Don't attempt to do any stitches or tell them about stitches or anything like that. But just say, we've got 2 of these so that it aids passing of the needle from one surgeon to another, and suture scissors. And that's it. Okay, so the main things are this bit, because if you show them these 2 instruments, these 2 they're probably not going to be that bothered about, right? These 2, however, they are going to be bothered about, because if you show them that you can use this to make a cut like that, okay, and you can use this one to make a smoother cut that goes all the way around, then that sells those 2 instruments.
Right. Okay.
Right? And then you say how you're going to lift the flaps up with these instruments. Okay? So what we need to do is get a paper and then draw it for you, so you can kind of